manageable disease. You know, the fact that there is medication, that doesn't mean that it's not, on the rise and, increasing,
Right.
Killing people all the time.
Or affecting the quality of their life.
Yeah.
I mean, that is really what you want to look at is, okay, there's a pill, but the quality of your life is forever altered.
Yeah.
Sure.
Forever altered. You may have bouts of illness. You never know when it's going to occur. Diarrhea is a huge issue. I know people who eat breakfast very, very early in the morning because they know that they can't leave their house for 2 hours.
Right.
But I also know people who've been living with this disease for 26 years.
Right.
They look beautiful and you would never know.
Right.
So it depends on who your mom and dad were.
Yeah.
As I say, your genotype, your mom and dad, how you've lived your life. If you abused your body, you're obviously going to have more difficulty.
Mm-hmm.
Yeah.
I think socially there's this notion that a manageable disease, diabetes, high cholesterol, these are manageable diseases. You take your pill in the morning and you go about your life just like any other day. And this is a little different. It's manageable because we have medication that helps people regulate the symptoms, but it's not the same thing.
Well, even diabetes, you talk about diabetes. I mean, I have friends who, have the disease, and unless they're on a pump that regulates it for them, they go through some horrible highs and lows. Horrible, horrible highs and lows. So...
Yeah, I guess it's not to say that high cholesterol and diabetes are easy to manage.
Yeah.
But I think for various different reasons, we have this assumption, this culture in our society that there's a pill for it. It's manageable. It's easy.
Right.
And it's just not the case.
That's why the rise is occurring in young gay men. They think. First of all, they think they're infallible. Secondly, they can take a pill, and they're now going back to the bathhouses. And there is a rise in syphilis. And I think it's for every 5 cases of syphilis, one person has HIV when they're tested.
Wow.
So it might be for every 6, something like that.
That's significant.
It is significant, 20%.
Yeah.
Maybe they didn't have it before, but they have it now. And we're right between New York and Providence, where the bathhouses are.
There does seem, and this was something I know you've mentioned before too, there does seem to have been a serious drop-off in public discourse about HIV and AIDS.
Oh, absolutely.
And likewise in the political realm, in the legislative, in the 80s it was a big thing, and you had a lot of politicians talking about it.
Well, the politicians aren't so much talking about it any longer, but thank heavens they are people also. Mm-hmm. And President Obama in Congress passed the Ryan White Act again. So it hasn't gone away. The funding actually increased. I think on a statewide basis, it's a problem. And Alliance for Living is faced with it. We were notified. Since 1991, we have been providing housing. Scattered site housing, supportive housing for people with HIV and AIDS. We've gone from 9 units to 45 units. 11 of them we've had for a very long time, and HUD forced the state of Connecticut Department of Social Services to have 5 agencies that provide this housing, in areas that are not metropolitan. You've got to take out Hartford, Bridgeport, and New Haven.
Okay.
So the other counties that have AIDS service organizations, we applied for approximately $500,000. We've had these 11 apartments since '91. We weren't chosen. So we have 11 people who are now precariously maybe we won't let them go homeless. You know, Representative Courtney and our legislators are all battling, and we believe we have a tremendous opportunity to override this. And I know there are organizations out there that will come to our aid, you know, to make sure, you know, that these individuals will not be uprooted from their homes. So, but the fact is, there's little of it coming into the state. It's going to much more metropolitan areas. And they're forgetting that in these communities, in these other counties, and this is probably nationwide, there are people living in them with HIV and AIDS. They're not all in the cities.
Right.
You know.
They visit the cities.
They visit the cities maybe, but they live in our communities, and we need to take care of those individuals in our communities. And in our community, it's a growing, I wouldn't call it a pandemic, but who knows? I mean, if you have the number of young people that have STDs, you know, and for 8 years, a number of individuals have been walking around with this disease and haven't been tested yet. You know, they say up to 25 to 30% of people that have the disease don't know it.
Right.
You know, we have 268, so let's just add another half onto that. You know, how are we going to be able to help those people if we don't have more money for medical case managers, we don't have more money for our food pantry, we don't have more money for our meals? We served 24,000 meals last year. We have a commercial kitchen, and we serve 24,000 meals between our food pantry and the meals that we shared with our members 3 nights a week.
That's amazing. And it's amazing how much this organization does.
Oh, we're tremendous. We are tremendous. Yeah. You know, I will pat myself on the back for everyone that's there, thank you, and that supports us.
Yeah, it's an amazing thing, and God, it has got to be expensive. I mean, just like the drugs.
Well, our budget is $1,200,000.
Wow.
We have 4.5, if you can call him a half, because he's anything but a half, medical case managers. Frank Silva is half medical case manager and half outreach case manager. And he goes out into the community and he speaks to agencies that care for at-risk people. And, you know, his whole charge is to find people who are infected or think they're infected and bring them into care. And that is happening. It took a while, but we've been working on it for 3 years. We had some wonderful people who have helped fund his position. And, you know, we are beginning to see the fruits of his labor. And the thing is, to bring people into care means that they will live longer and they will not spread the disease. You know, that is the most important part. The City of New London has given us a block grant. It was $12,000 for the last few years. This year they gave us $6,000. So we have to come up with, you know, an additional $6,000+. I mean, we're constantly in need of funding. DPH, the Department of Public Health, When we first started, they provided 64% of our revenues to help us with the case managers and the programs. Now they're 24%. And that means